My patient's story is one of those that represents patients who you aren't going to hear from. Afterwards, I'll be chilling over at the Real Progressive table. 9 years ago, I played a co-ed floor hockey game. My teammate collided into me head-to-head. Felt like a blow of a sledgehammer. I was floored, stunned, bloodied. I suffered multiple skull fractures and a moderate traumatic brain injury. Urgent care told me you could have lost your eye and scheduled a surgery right away. My first surgery, reconstruction of the eye socket, a metal plate under my eye anchored by 2 screws up front. When I came to, the room spun from double vision. I felt pain at the level 11. On a scale of 1 to 10, my head went supernova. I started vomiting. For some reason, they considered me ready for release. They gave me this barf bin and wheeled me out the door. So after performing reconstructive bone surgery, drilling into my skull and damaging the cranial nerve, they sent me home like that.
That ain't right.
It's not right. Shame.
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 It's our healthcare system.
According to teletracking's dashboard, they needed to clear that bed for patient flow efficiency. From this patient's perspective, they performed an act of violence on my body akin to torture. I continued with dry heaves the rest of the day. I couldn't keep down my pain meds. A week later, an x-ray revealed the physical force from my dry heaves displaced the metal plate, so they had to go in a second time to fix it. I didn't want them to, but they had to. Not until after the second surgery, they realized they'd forgotten to schedule my eye exam. So the ophthalmologist pulled on my new surgical wound, leaned on the nerve, and my broken nose. Needed a third surgery to fix that. So in their efforts to save the hospital money, it cost them 2 additional surgeries. 5 years passed before my diagnosis of the nerve pain, trigeminal neuralgia, AKA suicide disease. Not by my doctors, but by my dentist. They made me jump through hoops to get medical marijuana, which led to adult psychiatric diagnosis of PTSD. Because of the length of time that had passed after my accident until received adequate care, my top athletic health had deteriorated to suffering complex mental health issues and chronic nerve pain. I no longer trust my physicians. I refuse to let them touch me. I dropped my health insurance. That was my physical injury. Now for my brain injury. Because the hospital chose to treat me as an outpatient, unlike an inpatient, I didn't get a care team. Both patients types require numerous specialists, but for many outpatients, we're left asking, who is coordinating our care? From grand rounds on our care management, we see doctors are educated in interventions that meet our brain injury needs. Yet there's this huge disconnect between their training and their practice. They monitor our symptoms, but they don't follow through. We see months-long waits. We often go without the supports and services that we need. State health agencies admit we don't staff enough providers like case managers to cover all the needs of the patients. Fact is, our states are desperate for federal funding to fill those deficiencies. Political and medical leadership push a narrative they're delivering quality care as they cut back our health expenditures. My state ranked healthiest in the nation. If they listened to us brain injury survivors, they'd hear many of us end up unemployed, incarcerated, unhoused, or dead by suicide. It's as if we do not exist. Our outcomes don't matter. When leadership claims everyone receives quality care, they're effectively silencing our voices. Quality care should look like care that's timely, individualized, coordinated, adequate, and meets our whole person needs. It's even stated in the Institute of Medicine's Crossing the Quality Chasm, if they look back to 2001. Yet today, quality of care is defined by how efficiently care is delivered. Corporations now define it. Please advocate for us patients by taking back the definition of quality care. We're ignoring the magnitude of harm the system is doing. Hospital supervisors admit the patient safety data they collect only represent the tip of the iceberg. Before COVID, the third most common cause of death in the US was medical error. My friend Dr. John James couldn't get justice for the death of his son due to medical error, so he founded Patient Safety America. We fail patients by not holding the system accountable and providing better oversight. We're in a patient safety crisis and nobody is talking about it. There was a time when patients felt safe and received quality care. My dad's patients knew what it looked like. Longer face-to-face time to communicate our issues. They weren't limited to only 3 patient concerns. Plenty of time to go over the medical history, to do physical exams, all essential for quality care. Stuff we barely do nowadays. Corporate interests, lack of funding have eroded away these patient rights, so we no longer participate in our own patient care. Without enough hospital beds, health professionals, resources, equipment, patients' needs are not being met. We are underserved. Leadership is mismanaging our health care. So for all the money we spend on insurance, we're getting ripped off. We exclude patients from the system. We don't even know how many brain injury survivors are out there. They're going undiagnosed and untreated. How is this acceptable? Our mission must be to provide quality health care for all, which is unrealistic to expect of the current system to do with limited budgeting. It's unsustainable and a betrayal of our government's responsibility to do the welfare of our public. Empower and protect patients. A patient's Bill of Rights, a patient advocate for all, a massive national community and health needs assessment. We must determine the level of patient need and rebuild with generous amounts of federal dollars. Deconstruct and redesign the system so it serves patients, not corporations. The healthcare revolution is on.